So my name is Jackie. I am an international board certified lactation consultant and a registered nurse. I'm also a mom of four and have done exclusive pumping as well as incorporating pumping with direct latching. So definitely have a personal connection with pumping for sure. And I know many of you have said, you're here just trying to figure out which pump is best and how it all works. I know some of you might be first-time parents. Some of you might have other kids. And so your experience coming in is a little bit different, but we're going to cover everything that you need to know about these two pumps so you can make an informed choice. Or if you already have the pumps, then you can know how to use them better. You can get some tips and tricks. So we're going to use our handy dandy slides here, but I'm also going to take down the slideshow and give you some demonstrations of things once we kind of move through the slides. And we'll have an opportunity for some Q&A using that Q&A button that we've already explored a little bit. So everybody knows how to do that. Let's start with Glow. That's our wearable pump. And you might have heard Motif Aura and think of an older pump that we released. This is our newest wearable. It is different than Motif Aura. This is the Motif Aura Glow. So as you're shopping, make sure you notice that difference in the name because they are different pumps and they do provide different features. The main things about this pump are that it has powerful motor up to 280 mmHg. So that is just as strong as our Luna. It's still a wearable pump. It's still going to be a little bit different. It's going to feel different. It's not a one-for-one exchange for Luna, but it does have this powerful motor, which is really exciting in the world of wearables because a lot of times wearables are known for not having as good a suction. It also comes with 5 flange sizing options in the box, and I have those sitting here just to show you up close. We will look at them with the slideshow down so you can see them bigger. But it has these flange sizing inserts in the box, which are amazing. It also has our pre-programmed pumping sessions. Now, this is something that people are loving because it's sort of a set it and forget it option. And we're going to dive into exactly what those pre-programmed pumping sessions are. They're the same on Aura Glow and Roam. So when we talk about them and we talk about, how many minutes it spends here and what, the function is, it's going to be the same for both pumps. It's just one pump is a portable versus a wearable. And so we have a little bit different features there. But we are definitely going to dive into the details of those pre-programmed pumping sessions. So thank you, Robin. She says she loves the pre-programmed feature. Just tried it the other day. Awesome, awesome, awesome. I personally think that is what sets these pumps apart as well. Glow has this night light that we'll see again in a little bit more detail, but they're LED lights that shine down on the milk in the collection containers. So while you're pumping in the middle of the night, you're not, getting your phone out and trying to get the flashlight and see inside your clothing how much you've pumped. You are able to just get that with turning on the nightlight function and seeing it shine directly on your milk. So we also have, when we're talking about shining into those collection containers, they hold 6 ounces, which I know sometimes that's a challenge to find a wearable that holds, especially if you have an oversupply. We tried to keep that container where it was going to hold 6 ounces for you, but still be slim fit. So it does provide a little bit of a slimmer profile. It's not as big as some wearables. It's not as small as some of the ones that hold fewer ounces. So it's kind of a nice medium there. It's super lightweight. These pumps weigh less than half a pound. So that's another thing when we're getting a good fit. We don't want a heavy pump that's going to draw away from the breast. It's going to fit really nicely in your bra and not be super heavy and drag the tissue down. The pour spout is at the top. It does have a little stopper. We'll talk about, taking off the motor and what that looks like, how you pour the milk with the pour spout. And then it's super, super quiet. I love that about it, especially with people working virtually. I work virtually a lot. If I were to pump and be in a virtual meeting like this, I could be pumping right now and you would have no idea. You wouldn't hear it. And then also that silicone brush shield makes it really easy to get a feel, makes it really comfortable. So I see we had somebody say, it feels like a baby nursing, and that's awesome. We get the feedback that it's super comfortable all the time. Definitely feedback that we hear a lot. This section, as far as feeling similar to Luna, like I said, it goes up to 280. It's not a one-for-one exchange, but the pattern is a little bit different. I would say it doesn't feel the same as Luna, but it's going to be effective. Like that strong suction, it's still going to fall into that, wearable category where Luna is like, that is a primary pump that is going to, when we're looking at building milk supply, a primary pump is always really, really good to have on deck, and then use your wearable when you're not able to use your primary pump. But it is going to provide that same level of suction for sure. So let's look a little further here. We talked about the silicone shields and the flange sizes that come in the box, but here's just kind of an overview of everything you get. So those gray oval-shaped pieces are dust covers because the brush shield is silicone. We want to protect that and keep the dust from collecting because that happens on silicone. You can see all of those flange sizes there. You get 2 charging cords. You get the bra strap adapters, which are awesome for extending the space in your bra so you can get a good fit with the wearable. 2 motors, everything you need for double pumping. And you can see it all laid out here in this photo. As far as setup goes, it's pretty simple. There are not a lot of pieces. So this is what's involved with the setup. So the main pieces, we have the collection container, we have a diaphragm, the motor, we have a ductile valve, and the brush shield. So the way you want to do your setup, you want to start with the collection container and your diaphragm. And the diaphragm only goes in one way, so you can't get it backwards. It has a little, like a thumbprint indentation in it. That is what's going to face toward your breast. And then you're going to put your ductile valve in just like you would with any other pump. You want to make sure it's seated in there, sealed in there, kind of clicks in a little bit. You can kind of hear it pop in. That's exactly what you want. If you don't have your ductile valve in, you won't get suction. So we have to have that part. And then for the motor, you're just going to align it with the diaphragm, and it does make an audible click when you put it on there. And then you're going to take your brush shield. The thing I like about this, so soft silicone isn't always great for everybody, but this has that reinforced flange tunnel. So it is like the best of both worlds. We get the comfort of soft silicone, but we get the structure for the flange tunnel because it's double thickness here. And when you put it into the collection container, it's hard plastic in there. So it gives you the comfort of the soft silicone, but the structure of that hard plastic underneath of it, which is, in my opinion, the best of both worlds. And so then you're just going to take your finger and make sure that silicone brush shield is sealing all the way around. Make sure it's not tucked under anywhere because we will get leaks if it's not, all the way around there. And then your stopper, I can make my fingers work, just goes in the top here. Let's see. Once it's all set up, you are set to go. And then the only other piece that you would need would be your flange sizing inserts. Let me grab one here. So depending on your size, then you would just pop your flange sizing insert in to the brush shield, and you would be ready to place it in your bra. We'll talk about placement and everything a little bit further too. So as we are looking at the setup here, you can see it's just a few pieces. It's really, really simple to assemble. Once you do it once or twice, you can do it in the dark, thankfully, because that diaphragm only goes one way, which is super helpful. The flange sizing inserts that come with this pump are honestly one of my very favorite features. They come in the box. You get 15, 17, 19, and 21 inserts. And then the brush shield itself is a 24, but it's also available in 28. We know that most people need smaller flange sizes. And that is something that lactation consultants have been saying for a long time. I'm so grateful to Motif because they're like, yep, we hear you. We are going to include those in the box and have expanded sizes available. So you can see that there's 11, 12, 13, and 14 millimeter flange size inserts available as well. So lots of options. Hopefully, right out of the box, you can find the size that works for you. And it gives you the ability to try a few different sizes because we know that measuring and then getting your size, that's a guideline, but really you need the experience of pumping to see how your breast tissue responds. And with having a few sizes available in the box, you can do that right then and there. So a smaller sizing, would any inserts fit if bought from Amazon, like the 12 millimeter, if 12 millimeter is needed? So we have 12 millimeter available. And you probably asked that before I had this slide up, but we have all the way down to 11 millimeter available, which is just awesome. And yes, the variety of flange sizes is a huge point in the positive column for this pump. Additional sizes for purchase, those are on the website. And you can even just go in the search bar and type flange inserts and they will pop up for you on the Motif Medical website. So it's motifmedical.com and you can purchase them there. Yep, perfect. She says she can see it now. Awesome, awesome. Okay, so we've got the flanges covered. Let's keep moving here with the other things that are included in the box. So this bra adjustment, bra adjuster attachment is really, really helpful because the biggest thing with wearables is getting a good fit. And if you don't have enough room in your bra, it's going to be too tight. It's going to compress the breast tissue. On the converse, if you don't have your bra tight enough, it can allow the pump to shift around and that's not going to produce good results. It can really affect your pumping experience. So probably the biggest thing that we hear about wearable pumps is I can't get a good seal and it's not, giving me good milk output. First, you have to have a good motor for your pump. You have to have good flange size and you have to have the pump placed correctly and keep it in place correctly. So having the bra adjuster is awesome that it comes right in the box and you can get it adjusted to allow enough room. And maybe you don't need it and you have that perfect fit because you have a more stretchy bra. But just take into account that if the pump isn't working for you the way that you want it to, make sure those things are, the flange sizing and the bra adjustment, make sure you've checked those off the list and you're sure that you have it tight enough that it's not going to shift around or lean away from your breast, but also not so tight that it's compressing your breast tissue. And then, of course, the flange sizing, thankfully, you have many sizes in the box to try and hopefully find that fit that is going to work best for you. Shifting of the pump can also make the nipple off center and cause pain. So you might still get milk, but it's uncomfortable. So it really does start with getting the pump placed correctly in the first place. And that's why we've included those bra strap adjusters in the box for you. So with operation, I am loving that a lot of pumps are moving away from like really complicated operation to some pretty simple, we just push a few buttons and it works. And I love that about Aura Glow. It has a lot of features, but it's not overcomplicated in the way that you push the buttons. So the long press of the pause play button is what powers the pump on. If you just push it without holding it, it's going to pause and play, just like what the icon says on there. And this for mode, if you push that M button, it's going to cycle through the different modes. And there are icons associated with the modes so that you know which mode you're in whenever that little picture is showing up on the screen. It's super simple. When you look at it, you're going to be like, yep, I know exactly what pause play means. I know M means mode, and that is just going to make sense. Plus and minus can adjust that suction level so that even within those particular modes, you can do plus and minus to get to someplace that's comfortable for you. And it's not, you don't have to pull out an app to adjust it. You can do it all just plus and minus and the M button for mode, pause and play. It makes sense. It's not something that you're going to rack your brain about. How does this pump work? And then, of course, the night light, which is the feature that this pump is named after, Aura Glow. If you push that and turn it on, there's also adjustment within that. So you long press it and you'll see it get brighter and then you'll see it get dimmer. It has 3 different settings for the intensity of that light. So if you push the night light button, it comes on. If you hold the night light button, it is going to change the intensity brighter and dimmer. And I know somebody asked for me to turn it on, so I'm going to stop the screen share just long enough to show you exactly what this looks like here. So I'm going to long press and the pump's going to come on. Okay. And when I push play, the pump is going to start. Let's see if you can hear it. Not sure which side of my microphone is louder. Super quiet. And I have it turned up actually. So it's really quiet. I'm going to turn it down to like where most people would use it. Yeah, hopefully you can hear that. You're going to push that M button to change those little pictures across the top. And then that tells you what mode you're in. And then you have your plus and minus for adjusting. Now with the night light, let me turn off my light here and show you. So I'm going to long press. Push the right button. There we go. Long press and turn it on. And as I hold it, there it got brighter and brighter. And I'm going to long press it again. And it went back to dim. Can you see it getting brighter and then dimmer? There's 3 different settings there. It's kind of hard to show you, but you'll definitely be able to see the intensity change when you long press that nightlight button, which is so cool. I love it. And I've had, I'm always thinking of pumping in the middle of the night and keeping it quiet and keeping the lights dim so your baby doesn't wake up, your family doesn't wake up. But we've had a lot of people say, hey, just when I have my clothes on, like it's hard to see because, my clothes are blocking out the light. So the night light makes it amazing. Even in the middle of the day, I can turn that night light on and see what's going on with the glowing on my milk. So definitely loving the night light. Okay, so before we move on, I want to tackle any of these questions that go with the slides that we're on. Do you have good bra recommendations that work well with this pump? You know what? There are lots of options. Like we've seen the David and Adley are so beautiful and they have all these really cool details. And then we have like Target bras that are great, or there's some on Amazon. I'm a big fan of just read the reviews because there are some in a super inexpensive price range that are amazing. And then there are some really expensive ones that are also amazing. And so it really just depends on the features you're looking for. But you want something that's not so stretchy that it's not going to hold a wearable in place. So when you're looking, stretch is good, but we don't want it so stretchy that it's also not like providing enough support, 1 for your breast, but 2 for a wearable pump to really hold it in place. If you, if you're trying a bra and you think if I put my wearable pumps and I walk around with them, that they're going to really bounce in this bra, that's probably not a good choice. Yes, the nightlight is absolutely a game changer. Let's see. Perfect. I'm glad you could hear how quiet it was. Yes, super quiet. It really is. Oh, Savannah, I love this question about the light because we get this a lot. So I'm so glad you asked it. Does the manufacturer warranty cover if the light stops working or, if, with the light being warm, bacteria growth if the light's warm. So she has a 2-part question. Does the warranty cover the nightlight? It does. That's part of the 2-year warranty. But they're LED lights and like the likelihood of them not working is so small. So I don't want you to be worried about that. But yes, we want to make sure it would be covered under warranty. And then as far as bacteria growth, no, that light is not going to produce heat in the same way that, like a big LED light would or an incandescent or even a fluorescent bulb would. It's not going to change the temperature as opposed to the milk being next to your body. Your body's going to keep your milk at that temperature. And there's no evidence that, having it on too long or having your milk at that body temperature is going to encourage bacterial growth. We know that milk can sit out on the counter for a minimum, the most conservative recommendations are 4 hours on the counter. And so in the length of your pumping session, being at your body temperature and close to your body like that, not a problem at all. But that's a very insightful question. Let's jump back to our slides. and keep going here. I love the way y'all are thinking about this. You're really really have some use case questions here, which is awesome. So the pumping modes, these are the things that everybody wants to know about, right? Can you still use it like a regular pump? You absolutely can. You still have that massage and expression. And those are going to show up with icons. The hands are your massage, and then the milk drop is your expression, just like you would any other pump. And you still use plus and minus to adjust those. So you can absolutely use it that way. And then we have the specialized modes, the cluster feeding and general pumping, which we're going to jump into in detail. And I did help design these based on how babies feed at the breast. They're not going to ever, no pump is ever going to be an exact duplicate of the way a baby nurses at breast. But we can draw from the research that we have about how babies nurse and make our pumps better. And that's what we have tried to do here with this pump. So the idea is for you to be able to set it and forget it if you want to. And we are going to jump into those. So don't freak out. We're going to talk about what those modes actually are. I'm not just going to skim over it. We talked about the nightlight here. You can see it glowing on the milk, which is so cool. It makes it, you can see the difference here. We have one with no nightlight on and one with the nightlight on, and it's so much easier to see what's going on there. And definitely don't forget that you can change the brightness. So if you get your Aura Glow and you're like, oh, it's a little dimmer than I thought, make sure you're long pressing that button so you can adjust it. Now, here's a big tip for you. Definitely your bra fit and your flange sizing are two huge tips. Adjusting that nightlight is a big deal, but knowing how to pour your milk is a big deal. We don't want any milk loss due to a pouring issue. We don't want your motor damaged. So whenever you are pouring milk, this stopper here, it's not completely leak proof because we have to have a little bit of airflow for the vacuum to work. So don't think that you can lean over and do headstands or something and your milk's not going to leak. No, but it does keep it from sloshing out, that kind of thing. But that stopper is there, and then you want to take off the motor. So you're going to remove the motor completely before you pour milk, and then undo the stopper, and it's going to pour out of this little hole here. So my recommendation is practice with something that's not your liquid gold. Practice with some water and make sure you know what that stream is going to do when you're pouring your milk so that you don't have any surprises. And then always, always, always remove the motor just so you don't damage the motor when you're pouring your milk. This is a big deal. And if like there are three things you take away, it would be get the right flange size, adjust your bra, remove the motor before you pour milk. All right, let's, before we dive into Roam, let me just double check our question and answer. Oh, yes, breastfeeding moms have the excuse for crying over spilled milk. Absolutely, definitely been there, done that. Let's see. Loving the adjustable nightlight. Yep. Can you pump and refrigerate parts to reuse later? So that's a great question. A lot of people want to do the fridge hack. We know the safest recommendations are always to wash your parts with soap and water after every use. But in real life, we know a lot of people use the fridge hack. Again, the safest thing to do is always wash your parts and allow them to air dry completely before reassembling and using. If you do something like the fridge hack, just know that you can have like milk fat buildup on the parts from doing that, and it might affect how well your pump is working. So if you notice that, make sure, okay, I need to check my parts and wash them really well before you assume that maybe something's wrong with the pump. It could be a buildup or just the condensation of doing that. So ideally for your pump to work the best that it can with any pump, not just this pump, I mean, literally any breast pump, it would be to wash them and let them air dry in between. The CDC has said, all right, we know people are doing the pump hack. The risk is pretty low if the milk is collected cleanly, the parts are clean, but they still say washing in between is best. So I always tell patients that I work with, like, here are the recommendations. I know there's real life, so I deliver the information and you can do with it what you want. But if you're noticing that buildup or the pump's not working quite as well, it could be that the parts are still kind of wet from condensation or that they have some fat sticking to them in a funny way because they've been refrigerated. So how often and which parts need to be replaced? it's going to follow the same kind of guidelines. So if you are, you're pumping regularly, you're going to want to change those duckbill valves, diaphragms every 3 months at least. Sometimes people need to change them sooner. A lot of insurances will give you replacement parts as often as 30 days. So check your insurance plans for that. And the brush shields, they are going to last a bit longer. The inserts are going to last a bit longer. For most people, you can get 3 to 6 months easily out of those parts. But again, if your insurance is going to replace them more often than that, use the new parts. It's going to make your pump work better to have fresh parts. So always a good idea to change them often. Let's see. Answered that one. Before we move on to Roam, I just want to check here. Does the pump turn off by itself once it's full? It doesn't. It doesn't. It is going to turn off automatically at 30 minutes. That doesn't mean everybody needs to pump for 30 minutes, but it does that as a safety feature and to conserve the battery. But it does not turn off. It doesn't have volume sensing on it. We just found that a lot of the times that volume sensing technology is not very accurate. But the nightlight and your eyes are more consistently accurate. So definitely wanted to address that question. Ooh, carrying case. Elena, great question. I don't know. That's a good idea. I don't know. And then let's see, our final question about Glow here is this a hospital grade? I guess we have two. Is this a hospital grade pump? Hospital grade is a tricky piece of terminology. It's not really like a regulated term. There's not a great definition for it. If you're thinking hospital grade, like Medela Symphony or Amita, what is it, the Pearl, the ones that they wheel into your hospital room, no, it's not that type of pump. Those are multi-user pumps. Does it have hospital grade suction? It goes up to as much suction as those pumps. So different type of pump, but still has that high suction capability for sure. And then we had a question about larger breasts. I feel like this one works really well for lots of different sizes of breasts because this isn't flat. It's kind of hard to see on the camera, but it's got a little bit of a concave shape to it. And because of that silicone, it's really helpful to get a good seal no matter your breast shape. So I do feel like it works well for larger breasts and for smaller breasts too. And then elastic nipples, it does work well because that silicone does provide some help in holding back the areola tissue if you have elastic nipples. I always remind people that flange size is going to be the most important thing if you have elastic nipples too. Okay, let's see here. Yep, it comes with that cleaning brush. Thank you for mentioning that. I will show you what that looks like, the cleaning brush, so you can get into all the nooks and crannies. And then how many pumps can it complete before it needs charge? So it's advertised at 90 minutes. I will tell you that a lot of people, like pumping time, 90 minutes, a lot of people are saying it's going longer than that. So we advertise it at 90 minutes, but getting good feedback that battery life is lasting longer than that. Yes, the brush shield is silicone, and it takes about 4 hours to completely charge, but we're also getting feedback that it's going faster than that. So, all right, let's see here. Uh-oh, did I just click not share? There we go. So let's dive into Roam. Roam is a portable pump that comes with cups, and it also goes up to 280 mmHg on the suction. It also comes with 5 different flange sizing options in the box. Those pre-programmed sessions are the same on Glow and Roam, and I'm going to show those to you in more detail, of course. The cups are really a slim design. They're lightweight. I like that they have clear markings, like it's easy to see the markings on the side. They hold 5 ounces. So that's what's up with the cups. They make this pump so portable and really convenient. Made from good quality here. We're not including all these toxins in it. You can see it's free of all the 3-letter things, plus DEHP, phthalates, which is a very important consideration when we're talking about medical grade devices here. The lanyard is really convenient. People like that the pump is lightweight, so it's not heavy hanging around your neck. And then this pump has a 2-hour battery life. So lots of pumping can be done on one charge with Roam. Here's what comes in the box so you can see. I didn't mention with Glow, but both of them come with a flange sizing measurement tool, which I absolutely love. We have all the cutouts here, plus it has a ruler that comes with Glow and Roam. So this is going to help you it's got instructions to guide you to your flange size. Smaller is better. We're not doing this, size 24 for everybody. We recognize that smaller flange sizes are better for most people. And so included in the box are 16, 19, 21, and 24 millimeter sizing options right in the box with additional sizing options available on the website. And you can see all of those inserts there in this picture. And as far as setup goes, it's very simple. Again, these cups don't have a lot of parts. So let me show you that. You have the actual cup, the brush shield portion of the cup, ductile valve, backflow protector. And so we're going to start with the brush shield portion. I'm going to put that diaphragm or backflow protector. I know it's known as different things. We call it a diaphragm. We're going to put that into place and you're just going to run your finger around, make sure the lip is all the way down. And then we're going to put the ductile valve on. And this cup has a buckle closure. So up here at the pour spout, it hooks on and you're just going to bring it down, and I don't know if you can hear that click, but it clicks into place. And then it has a flat bottom where it will sit on the countertop or wherever, which is really nice. It will sit upright. The only other piece you would need then is your sizing insert if you're using one, and it fits right there. This is the, pop it off there, the tubing adapter. Yeah, I can. There we go. So you would hook that to your tubing, and it can be turned either direction depending on what's best for you and the cups, but that fits right in there. So super easy to assemble, not a lot of parts to wash, which is always helpful when we're talking about a cup or a wearable option. So once you have it set up, then you're just going to attach the tubing and you are ready to pump. Flange sizes, like we said, the actual brush shield is 28, but it accommodates the flange sizes that are in the box, 16, 19, 21, and 24. We also have 13 and 15 available. And this is a nice up-close picture of what they look like. They are quite comfortable and well-made. So the operation, again, like I said about Glow, I love that we're going to simpler operation. This pump, you're going to get it and be like, I know exactly what those buttons do. I don't have to, go study it. You're just going to turn it on. And when you long press it, the display lights up. And you can hear it. It's quiet. And then you're just going to use that M to move through the modes. As you move through the modes, the different pictures light up relating to which mode it is. So it has a different icon for each mode, and then plus and minus to adjust the level. That's it. That's all you need are those 4 buttons to operate this pump, which is awesome. And when we're talking about those modes, again, you can use it just like Glow with Classic. You can do massage and expression just like you normally would, but you can also use the cluster feeding, the general pumping, and switch back and forth and adjust the intensity for those modes. And we will talk about those here in just a bit. So when we talk about the discrete pumping, sometimes people are like, oh, wearable, portable, what's best? This pump can be super discreet too by just tucking the tubing underneath your clothing, and you can even tuck the pump motor itself with the lanyard underneath your clothing. And these cups are a nice slim design too. So let's talk about the flange sizing and the modes that apply to both of these pumps. Like we said, that nipple measurement tool comes in the box for both of them. When you are trying to get your flange size, if you're struggling, you can always reach out to an IBCLC who can help you with this, but we wanted to give you tools that you can pump, hopefully, without having to go through a bunch of extra steps. You can get the right size pretty easily right out of the box. So we want to use that nipple measurement as a guide. And for most people, we're measuring at the base of the nipple. We don't want to include areola, but it depends on if your nipple is flat or inverted. You may have to do a little bit of coaxing to get it to come out. But we just want to measure at the nipple itself, not back on the areola. And for most people, adding 0 to 3 millimeters to that is going to give them a comfortable and effective flange size. So that's a range. That means with the multiple sizes in the box, hopefully you can try 2 or 3 different sizes and say, all right, adding 0 works best for me. Adding 2 millimeters still works, but it's not as good as just going right with my nipple size. And your nipple size can change throughout your pumping journey. So make sure that if you are pumping with a size that's comfortable and then it becomes less effective and less comfortable, check your size and see, okay, did something change? Did I have a hormonal shift that caused my nipple size to change? Definitely doing a pumping trial is important. So we don't want to just use the measurement as the end all and be all for your flange size. You want to pump with it and see which size within my range is giving me the most milk output and no pain. Pumping should not be painful, just like nursing should not be painful. And so if it's painful, flange size is almost always the culprit. That's what we want to check first. So just remember that old way of thinking that 24 is a standard size. Thankfully, Motif is changing things up and telling you the most up-to-date information, and that is not standard. Smaller is what we're seeing for most people. So you have the tools in the box to identify what's going on. So here's a picture of how to use that flange sizing tool. You can see this nipple is poking through, but we don't have extra space around it. We don't have, the areola is not included in that measurement. It's just the nipple itself. And that's what we want when we're looking at getting your flange size. When you are placing the cups or the wearable pump, either the Roam cups or the Aura Glow pump itself over the breast, remember, we want some gentle inward pressure. If it's not held snugly enough to your skin, you're not going to get a good seal, and it's going to be able to shift, whether it's cups or the glow itself. And you're not going to be able to maintain that suction or get that good output that you're looking for. So make sure it's in place, a little bit of gentle inward pressure, not smashing your breast tissue and compressing your breast tissue, but just held snugly there. And making sure, doing a little test run of that, and different bras, like we said, will hold it in place better than other bras. So do some activities like go wash the dishes and see how it shifts. Go move around and fold laundry and see how it shifts. Can you do cartwheels and pump? No, probably not going to happen, but you should be able to move around and keep it snugly in place as long as you're not like jogging or jumping big movements that are going to cause the cups or the pumps to shift. All right, my favorite part here, we're going to talk about these modes here. So you can see the general pumping icon is the milk drop with the heart in it, and the cluster feeding icon has 2 little milk drops. The way that we would use these modes, general pumping is just doing for you what I always recommend for moms to do when they're pumping, and that is use your massage mode until you get let down, then go to expression. When your milk starts to slow down, maybe halfway through the pumping session, go back to massage mode to try to get a second letdown. When you are nursing a baby directly, you have multiple letdowns. So we're just trying to encourage your body to have another letdown by going back to massage mode. And general pumping does that for you. So it's going to be in massage mode for 2 minutes, then it's going to automatically switch to expression for 13 minutes. Then it's going to go back to massage mode for 2 minutes and then back to expression to finish you out. And you can adjust with plus or minus across 9 different levels of suction when you're in this mode. So you can find something that's comfortable for you. It shuts off at 30 minutes. Again, you probably aren't going to need 30 minutes. Maybe you only need 20 minutes of pumping. So just because it automatically shuts off at 30 minutes doesn't mean you have to ride it out that whole time. Do what works for you, but it will automatically shut off at that time. General pumping can be used anytime. It can be used for your regular pumping sessions. It can be used to add in a pumping session if you're trying to increase your supply. It's appropriate for all of that. Cluster feeding mode is just a way to give some of that on, off type of stimulation to the breast to help get a hormone spike, which can sort of mimic what babies do when they're trying to, maybe in a growth spurt, they have a little bit of cluster feeding going on. They're trying to get that hormone response to increase milk supply. So they feed and then they take a pause and then they feed and they take a pause. It feels like in the evenings, maybe that's all you're doing is nursing your baby. So we've just shrunk that down into this cluster feeding mode, which is going to give you 7 minutes of pumping and then 5 minutes of pause. And in that pause, you're going to feel very light suction, just so you know the pump is still working. It's not going to be suction that's going to cause you to actually have any milk come out. It's just a pause with a little bit of suction to make sure that you know the pump is still on. So with that expression and then pause and then expression and pause, we are having that on off, kind of like what you would do with a power pumping session. But power pumping lasts, a full hour. Power pumping is 20 minutes pumping, 10 minutes rest, 10 minutes pumping, 10 minutes rest, 10 minutes pumping across a full hour. This is just like a mini version of that in a 30-minute session that can help you take advantage of that little bit of hormone spike we have when we have pauses in the pumping like that. So you can use this anytime as well. With power pumping, I always tell my patients, like, we don't want to just use power pumping all the time. It can be too much stimulation. It can make you sore. It can lose its effectiveness if we're using, these big power pumping sessions all the time. But with cluster feeding being limited to that 30 minutes, you really can use it differently. You don't have to just limit it to once a day or only for a few days in a row like we do with power pumping. So it's a really cool mode. These modes are available on the Aura Glow and the Roam. So either of these two pumps, you're going to have the option for these two modes. Let's check in with our questions here. Yeah, yes, I agree. The modes are amazing. So Cassandra, are they the same as the collection cups? I think you're asking, correct me if I'm wrong, but are these cups the same ones that we sell separately? The ones that come with Roam are the same ones that we sell separately that would work with Luna or Duo. So yes, they're the same cups. They just come right in the box with Roam. I agree, Taylisha, it comes with a lot of things in the box. Do the cups have silicone flanges like Glow? They don't. They are hard plastic. They are, they have a little bit of that concave shape, so they're not just completely flat, which is sometimes hard to get a cup to fit well if it's just completely flat. But the sizing inserts, which, I mean, in my experience, most people are going to use a sizing insert because this is 28, and I rarely find somebody that is going to need, rarely find somebody that's going to need 28. Most people need smaller, and the inserts are soft silicone. Yes. So if I'm 17, would 16 work? I would stay in that range of 0 to 3 millimeters added onto your exact nipple size, but keep in mind that your nipple size can change. Okay, we're asking about leaking for the cups. You know what? I have 4 kids, 4 sons, and I let my younger 2 try all the things in these. They put tea in them, they put regular cow's milk in them, they put all kinds of things in these to do experiments and see about leaking. And we did not have any leaks with all of our experiments. So as long as they are, you have that buckle closure and you're hearing that audible snap and you're making sure it's closed all the way around, we do not have leaks with these. Do Glow and Roam use the same flange inserts? They don't. They use, Roam has the same inserts that are used with the cups. So they are slightly different just because this is a hard plastic and Glow has the silicone brush shield. Maddie. So glad that you've learned a lot and so excited for you. Definitely. She says, I've already learned so much more than I was ever told or taught when pumping for my firstborn. Yay. That's, the more kids you have, it seems like the easier it is to, like you add skills, you add knowledge each time. You'll be surprised. Do either pump have a memory? If so, leave off on level mode. So not a memory. They do not have a memory, and they all let's see. I think you're asking like where does it come on when you turn it on? It's going to come on at the level that you left it off on Glow, and then it's not a memory on Roam either, but it always starts back at 1. So Glow is going to start at the level you left off on, and Roam is going to always go to that lowest level when you start it. Let's see. Ooh, Stephanie, this is such a good question. Is it true that wearable pumps can decrease milk supply? Any pump, no matter what it is, no matter what type it is, if it is not effectively draining your milk, it's not comfortable and not giving you good output over time, that can decrease your milk supply. Same if you have a baby who's not nursing effectively, that can decrease milk supply over time as well. So if you find that a wearable doesn't drain you as well as like the Motif Luna, you would just want to be very cautious about how much you're using a wearable, and that can absolutely happen. That's why we educate that wearable and portable pumps are secondary options. Something like the Motif Luna is a primary pump. Does that mean that wearables and portables are bad and they're going to decrease your milk supply? No, it just means we need to assess how your body's responding. Most people respond really well to something like the Luna. And to get a wearable or portable to work well, there's a few, extra hurdles. We've got to get that bra fitted right. We've got to make sure flange size, of course, with all pumps is right. But some people might not find they get quite as much milk with a wearable. So if that's the case, they want to make sure they're using their like Motif Luna regularly and only using that wearable when they can't use their regular pump. So we're balancing it with both. Or maybe you're nursing your baby when you're together and you run out for an errand and you use something like the Motif Aura Glow or the Roam, but you're coming back home and you're nursing your baby who nurses effectively. You're going to be balancing that. It's fine. You're not always removing milk with a wearable or portable, especially if that isn't as effective for you. Yes, the inserts come with the pumps. Great question, Michaela. They come in the box. And Stephanie is saying, I have those cups. They don't leak. They're great. Love that testimony. Are the Glow and the Roam dishwasher safe? So we always want to caution that you can put the parts in the dishwasher, but you need to be aware that high temperatures of the dishwasher can warp pump parts for all pumps. It's not unique to Motif by any means. So, it's always safer to wash them by hand. Even the microwave steam sterilizers, like that's a high amount of heat. They should be just fine. But if your dishwasher has really like big fluctuations in temperature and it gets really, really hot, it could potentially warp the parts. So you just kind of have to know your machine. And again, that is the same for all pumps, not just Motif pumps. Anytime you're talking about silicone and plastic in the dishwasher, we have really big variations and really high temps. It can affect those parts. So just watch out for that. So we want to talk, we have a couple more slides left. This one I mentioned a little bit earlier, but you may be able to get your pump parts covered by your insurance. For most people, you can get those what we call resupply kits, where you're going to get everything you need with your collection cups, like the cup itself, the inserts. That's going to come in a resupply kit for your Aura Glow. It's going to basically be everything except the pump motor. You're going to get the resupply of what you need for those replaceable parts a lot of people covered by insurance, and a lot of times it's every 30 days. So make sure you're checking about that. If you don't know like where to find a durable medical equipment provider who sells these through insurance, on our website, we have the insurance lookup tool where you can go there, punch in your information, and it's going to spit out a list of DMEs that work with your insurance. And you can check with them, hey, do you carry parts for the Motif Aura Glow? And see, does my insurance cover that? And get them shipped to you that way. So we highly, highly, highly encourage you to check on that if you're not already. Almost every day in my private practice, I work with patients who are like, oh, I had no idea. I just paid for my parts, the last how many months, and found out I could get them as an insurance benefit. So make sure you're checking on that. There are 2 types of resupply kit for the Roam. So you can get the cups, which it comes with, but if you prefer flanges, you can get that as an option as well. So what comes in with the collection cups are you're going to get the 28 millimeter brush shield, and you're going to get all of the inserts in there as well. With Glow, you're going to get the brush shield, and you're going to get all of the inserts as well as your the other parts that you're going to need, like your diaphragm, ductile valves, with both of these options as well. So there is a 27 millimeter brush shield available for Glow. And then we do have the other sizes of inserts available. Again, those extended sizes available on the website, along with bottles and nipples and the sealing discs, all the different accessories on the website. So if you're not finding something that you're looking for, there is that little magnifying glass, and you can type it in on the website and see all of those different options pop up. So we want you to know our customer service takes all of this so seriously. The pumps do have a 2-year warranty on the pumps themselves, and 1-year warranty on the battery. Parts and accessories are 90 days. And we do everything we can to make sure the pumps do have a 2-year warranty on the pumps themselves, and 1-year warranty on the battery. Parts and accessories are 90 days. And we do everything we can to make sure that things run as seamlessly as possible. So our customer service is amazing. Everything is in-house. It's a small team. They do the live chat, they do the emails, they do the phone calls, all the same team. If they have a troubleshooting issue that they can't address, they will reach out to me as an IBCLC and see if I have tips and tricks. Like, we care about your pumping experience. So we want you to have the information for how to reach out to us. And let me check our Q&A here. We're ending right on time. Let's make sure we get all of these questions answered. So can the collection cups work with Duo? Absolutely. They sure can. They work with Duo, they work with Roam, and they work with Luna. Love that it comes with brush shields or collection cups. Yes, so you can do just your traditional flanges or the collection cups. And for some people, one works better than the other. So we have both of those options. Most insurance covers most storage bags as well. Oh, Emily, bless you for mentioning that. Yes. I should have said that. Many insurance payers are covering breast milk storage bags, and they will be shipped to you just like the replacement parts. So definitely something you want to ask about. And again, you can use that insurance lookup tool at motifmedical.com, put in your information, and it will tell you different DMEs that carry these and work with your insurance. Super helpful. Is the Motif Aura Glow brush shield compatible with the cups? It's not. It's designed specifically for the Glow, but that is a very insightful question. Awesome. Well, thank you all so much for joining. I hope you have a great afternoon, and hopefully you enjoy your Roam or a Glow. Bye, everybody.